Hey, Barbara.
Hey there. So I have another attempt at an ablation procedure coming up next Tuesday, and I met
Okay.
at a pre-test meeting today. And when I mentioned that I took a bunch of supplements and also some essential oils, the nurse kind of threw her hands up in the air and didn't even want to deal with them and just said, stop taking all of it now, a week before. And that seemed a bit extreme to me.
The rule of thumb is usually 72 hours. And I say rule of thumb, that's not my rule of thumb, that's physicians usually say 72 hours.
That's what I thought from the last go around.
Yeah,
I know they're
yeah.
particularly concerned about anything that would affect bleeding time.
Exactly. Bleeding is the big one. But, just to risk anything and just give them, the body the way that it is and not having, herbs or things influencing something, and this usually includes medications too, by the way. They usually have you go off everything 72 hours prior.
Okay, that's what I thought. And I just wanted, I guess, some reassurance to do what I had done before.
Sometimes like a nurse or a doctor, you're dealing maybe with some of their frustrations from previous patients, or they might have opinions that don't necessarily agree with some of the things you're doing, or
Or it's not in their database and it's too
yeah,
time consuming to enter it in the record.
Yeah, it happens, So Tuesday's the big day, a week from today.
Yes.
Yeah.
Because
Okay.
I didn't want to stop things too far ahead because they seem to be, if they're useful, why would I stop them before I need?
Yes. 72 hours is pretty solid. And then, afterwards, do a little galbanum, do a little black cumin just for recovery and all that. And you should be pretty solid.
Thank you very much.
You're so welcome.